Doctors and computer experts are raising serious safety concerns about the federal government's new e-health record system due to be rolled out in July. They say there's no system in place to ensure the safety of e-health records and that personal information is vulnerable to hackers. Those in charge of setting up the system insist it will be secure. Medical reporter Sophie Scott has the story.
The idea behind electronic health records is that patients can access their own medical information, making it available to doctors when they need to. But some medical and computer experts are worried about the security of the new system the federal government's introducing.
I'm absolutely concerned about the safety of having electronic health records available over the internet.
Patients will be able to access sensitive medical information from home computers, smartphones and even public computers. Internet security experts say hackers will be able to access confidential medical records because it will be up to patients to make sure their information remains secure.
What will end up is that these electronic health records will be stolen and used for identity theft.
They estimate as many as 4 million personal computers are improperly accessed by hackers every year.
Until we get the security issues resolved satisfactorily, I would suggest to all Australians that you simply do not opt into this system.
But those involved with developing the system insist it's secure.
There's multiple points of defence. One is the individual taking responsibility for their own information as well. But in order to get onto the system, they need to be able to have a log-on, which again brings some more security.
In an article in the Medical Journal of Australia, doctors outlined potential problems that might occur.
A medication name might get swapped, a dose for a drug might get changed, or your allergy might not appear, for example.
They're concerned that there are no measures built in to monitor the safety of the new system.
We need to manage these errors now, rather than rush to a July 1 deadline and then manage these errors post-implementation.
The patient will know who's looked at their record or looked at the health identifier because of a very robust feedback loop that comes back from the provider of the service to say who's accessed the record.
The Department of Health and Ageing didn't respond to the ABC's request for an interview. Sophie Scott, ABC News.